Hello, I'm Loretta Bush, President and CEO for Authority Health. We are a public agency committed to strengthening the healthcare safety net through medical education, assistance with health insurance enrollment and navigation for our most vulnerable communities, and by providing high quality, affordable primary care services at the community level. Our nation is experiencing a critical primary care shortage. It is most acute in low-income rural and urban populations. Additionally, vulnerable populations such as immigrants, the homeless, and those with special needs have difficulty finding primary care physicians. The Teaching Health Center program was funded through the Affordable Care Act to provide more primary care physicians to serve these populations. We are proud to be one of the largest teaching health center programs in our nation. We offer residencies in internal medicine, family medicine, pediatrics, and psychiatry. Our residency program is embedded in an organization committed to health equity. This implies a commitment to reducing health disparities defined by race, ethnicity, sexual orientation, disabilities, and other factors. Our residents receive special training in population health, trauma-informed care, as well as implicit bias. They develop an appreciation for neighborhoods, schools, and workplaces of their patients. And when they complete our program, they will be outstanding community and people-centered physicians. If you share these values and are looking for a challenging place to develop your specialty in the context of a diverse community, you will find no better environment in which to learn, grow, and provide much-needed medical care. Thank you for your interest and good luck with your residency search.
The residents virtually uniformly have said that the program delivers what they had hoped for, that the mission and the vision for Authority Health has been acted upon and delivered upon, and that they're getting the kind of education that will allow them to be successful in their future practice. It is very common for our residents to literally fall in love with the population of people we take care of. So that's really rewarding. We've had residents who recognized that the specialty that they initially chose wasn't the exact fit, but they've moved into one of our other programs because of the mission of Authority Health and the way we deliver. And so they've not left Authority Health, they've made a choice of specialty that has worked for them and of course for our community. Why don't we just start with Anthony, and we'll go Anthony and Jeremy and Shubi and Wendy, and introduce yourselves. So Anthony?
My name is Anthony Adetamiwa. I'm a PGY2 in pediatrics at Authority Health.
Perfect. Jeremy?
All right. Hi, everybody. I'm Jeremy Hockstrom. I'm a PGY2 at Authority Health. I'm doing internal medicine.
Shubi?
Hi, I'm Shubi Kalwani. I am a third year PGY3 and family medicine at Authority Health.
Perfect. Wendy?
Hi, everyone. I'm Wendy Bessler. I'm a PGY4 in psychiatry at Authority Health.
Awesome. So Jeremy, would you please talk a little bit about what attracted you to Authority Health to do your residency?
Yep. So I'll start off by saying that I've had family growing up, down in, I'm originally from Tennessee, but I also have family that live in Mississippi too. So for me, seeing some of the healthcare disparities just within the smaller towns, Mississippi, which is part of not only, it's part of why I went into medicine in the first place was because I wanted to be able to help, the people that with those kind of needs. So when I came to the Authority Health program, when I interviewed here, just kind of looking at the mission as a whole, understanding that it's a more of a community-based program and how they structure their academic curriculum, which was that, it's different from other programs, but it's something that kind of resonated with me pretty well. So seeing that the structure of this program, the goals of really serving I guess the underserved in every form, is something that I felt absolutely comfortable with, and something that I think really would enable me to fulfill the goals that I have in medicine going forward. So so far I've been here for a year, and I'm absolutely happy with it. So
Thank you very much. Shubi, would you also talk about what attracted you to residency at Authority Health?
Sure. So for a residency specifically, I wanted to work in an underserved community. So Authority Health was perfect for that. It was in Detroit. I grew up in the Metro Detroit area, so I wanted to be close to this area, and I really liked the population and the pathology that we have in Detroit. So that was one of the reasons I wanted to be in this area. And another thing that attracted me to Authority Health was the wide variety of places that you can rotate. So as a community program, that's already a little bit different from academic setting, but in addition to that, we rotated through multiple hospital systems, multiple attendings in different clinics, private clinics, FQHCs, and a lot of different, just even community medicine places where you get to interact with people in the community outside of a medical standpoint. So there was just more variety and more like grassroots and one-on-one interactions with the different people of this area. And that is, I think, a very well-rounded experience and a unique experience when it comes to Authority Health. So those are two of the main reasons I wanted to be in this area at this place.
Wonderful. Thank you. Anthony, would you talk a little bit about the aspects of Authority Health and your experience in the program and how it perhaps validated your choice?
Absolutely. One thing that really helped solidify my choice for picking Authority Health was just throughout the course of my time here, about the 1.5 years that I've been here so far. I've been able to see so much in so little time. Sometimes I even ask myself, could I even, if I left residency today, would I be adept to be able to actually perform my duties as a physician? And I feel like with the plethora of so many diverse disease processes and cases that we see just in that first year, without a doubt, that definitely validated things for me. And that's just number one. But the icing on the cake was just the culture that we have here. We're able to, everyone here is always going the extra mile to be able to actually help you meet your goals, help you meet your needs, any questions that you have. And it's a top-down culture. Any question that you may have, everyone is always available to be able to answer for you, or at least, help you get the answers that you need, from our program directors to everyone in an administration office. Everyone has been amazing, and it's been awesome being here. There really is a culture of excellence that is here, and that is it's for lack of better words, it's very contagious for all the residents as well. It's a family culture. It's, we really are grassroots, and we want to do the best that we can to reach out to the community. And that's what Authority Health does. You see that everyone here is always doing the best that they can to make sure that not only our patients, but even some of our community leaders have a voice, and we all try to connect every aspect of healthcare, every aspect of the community together to be able to really uplift everyone as a whole. So without a doubt, this is the best choice for me, and I have no regrets at all.
Thank you, Anthony. And Wendy, could you talk a little bit about your experience with Authority Health and aspects of Authority Health perhaps that validated your choice?
Oh, absolutely. I feel incredibly fortunate to be actually part of this residency program, especially from the aspect of what Authority Health actually stands for, which, as was just echoed, it is a very grassroots. It is down to our individual communities. And what is absolutely phenomenal is that so many times in residency, especially with some of the other programs, there's a tremendous focus on being in the hospital full time, and you do see great pathology in the hospital, But I will tell you, here in our area, you will see even better pathology actually in our communities, in our individual communities. And we are given, especially, as you progress through your residency, you're given more and more responsibility. And it's phenomenal because, especially, I'm psychiatry. I know that some of our leaders have really gone out of their way to truly listen to, what we felt that we needed more education on. And they came right up and stood right up and made sure that all of those needs were met, that we could go into the community and really help these individuals and really establish a differential diagnosis that we could follow through on. Just one example was I was at the Development Center, which is one of the outpatient psychiatric centers, and I was very excited because we were able to bring in a lab tech so that we could actually serve the community a lot better, because the labs that we needed, we would have to send the patient to an outside source. And many times the patients couldn't do that. So all we did was all of us got together. We said, hey, this is what we need. And we got it. And we were able to get those labs done right there where we were sitting. So it's that kind of, pulling together and being part of something that's much bigger than you. I think that really attracted me initially to the program, and to be able to see it grow the way it has is absolutely phenomenal.
Thanks, Wendy. Jeremy, could you talk a little bit about the nature of the program from the perspective of being community-based, and perhaps comment on the value of the population health certificate?
Yes. So what I've, coming into this program, or even for me, I would consider myself that I've always been one of those types that just always likes to volunteer and give my time in general, because that's something I just love doing in general, from high school to college, on into medical school, and now on into residency. And so when it comes to the community aspect, one thing I did realize early on with Authority Health was that we're pretty big on community outreach and giving back, and we're always getting involved. We're always being fairly proactive in volunteer projects all the time, whether it's like the soup kitchens or the food banks. We're always finding things. Even just like a week or two ago, we're at one of the community gardens, and so just the fact that we're always doing that, it for me, it really hits the nail on the head when we were, it's like the epitome of community outreach in that regard. And so that is something that I definitely appreciate doing. We put medicine aside for a minute, and we really go into the community, go to be with essentially the people that we're treating, and getting to know them, that much better, and understanding their needs. And so with that, it essentially ties into the population health certificate, because by being in the community more, then with the population health certificate, we're learning about the health disparities that are out there. What is it that's why can't this person get this prescription? What's holding this person back from following through with the plan that you've laid out as their physician, the ones that are caring for them. And so it really allows you to sort of step in their shoes a little bit and say, I'm gonna have to think outside the box a little bit more on some of these plans and some of these things, so that I can ensure the best health for my patient and the best care possible. So with the community, with the population health class, it's very, I would say, unique to Authority Health for sure. But in my mind, really, every program should have it. And it's something that I think in general will start to grow among other programs too. But I find it very valuable, especially to the Detroit area, that we should definitely be, continuing something like this. So overall, I've begun to learning, even as much as I think I might have known about health disparities, we're really diving into, the deep statistics, literally pulling up all the statistics and really understanding county by county, like what are the disparities and ways that we can sort of combat those disparities. So I think that's a big plus.
Thanks, Jeremy. Wendy, would you talk a little bit about, the nature of the program, perhaps talking about the community linkages and the population health certificate program?
Absolutely. So I think, again, one of the greatest things about our program is that we do have this amazing population health certificate that we do receive, and we're very, very well educated. And it opens your eyes tremendously to many of the disparities that are in our communities and in our nation, in all honesty. I think it's absolutely phenomenal too that we have, again, an amazing opportunity to actually be an interactive piece of all of this. So, when you see a patient, many times we don't have, you might have come from a completely different background, and it might be hard to relate to that patient. Having the ability to understand some of the background on the patient that you're seeing and understand what kind of economic resources they may or may not actually have, and how you can actually, as a physician, treat them in a much, much better and safer, and in a way that you can actually support them and their health. I think that's lacking in many, many programs. We're so lucky to have that here. And I will say we have an amazing outreach program. I know I had mentioned too in the past that, I was very excited when COVID hit, our entire area, we were so very, very concerned because we were hit very, very hard. And we did not have enough testing facilities. Our hospitals were overrun. We didn't have the testing facilities, and we had a population that was incredibly at risk. And our program stepped up to the bat. We went and said, hey, where do we need to be so that we can test our community? And it was amazing because Dr. Yoder, I stood there, arm in arm, side by side with you, doing nasal pharyngeal swabs in church parking lots, in the rain, in everything else. And I was absolutely thrilled to be part of that, because that makes you part of your community. That is what binds us together. And that's why we do what we do. That's why we became physicians, is actually to have that.
Thanks, Wendy. Anthony, would you talk a little bit about the resources provided and the quality of the faculty that you've had the opportunity to work with?
Absolutely. Yeah, our faculty is awesome. Our program director is actually able to rotate with us at Children's Hospital of Michigan, as well as the assistant program director as well, Dr. Daisy, and they have been spot on at all times. From being able to teach while rounding, being able to be available at any given notice via email, via text, whatever format of communication, they are always there to help educate the residents that are in the program. They have always continuously advocated for us to make sure that we get the best education that we can throughout our time and tenure at Children's Hospital of Michigan and other places that we rotate, and other rotations as well. They want to make sure that we actually leave Authority Health not only as just one of the greatest residents that we could be, but even more so one of the greatest physicians that we can be. And because they actually understand that education does not just stop here, but they actually embody a form of willingness to continue education even after you graduate. And a lot of our residents who have graduated from the program, some of our alumni that I'm in constant communication with now, they always are very thankful for the faculty that we have at Authority Health, because they've continuously given back, and they've built that culture from intern year all the way until senior year, until even now, that culture to continue to strive for success, to continue to put your best foot forward, to work hard and make sure that you meet your goals, and continue to press the boundaries of what you know, in areas that you may be uncomfortable with and areas that you are comfortable with. So they have always been awesome in that regard. And in regards to the resources that are available, I'm very grateful for like the John Hopkins modules that we have in our pediatric program. Of course, being able to have access to the the AAP prep questions as well. Those things are very key, and everybody that I talk to in regards to our alumni are always telling us when you study for your boards, you need your prep questions, and we have access to that. And one of the major areas that we need to study in regards to pediatrics is primary care, and Authority Health excels in that. Not only just from the John Hopkins modules, but even from our community clinics, our continuity clinics, our FQHCs, some of the private clinics as well. Every preceptor there is always ensuring that we have the best education possible. There's so much autonomy there. When you talk about a resident ran clinic, we truly are running those clinics during those continuity clinic days. We are putting in the billing codes. Of course, they're checking in. Of course, some of the coders are also checking it. But we ourselves are putting in those codes. So without a doubt, not only do we leave Authority Health excelling in academic pediatrics, but even primary care as well, which of course we are known for. So our faculty is top of the notch.
Thank you. Shubi, would you talk a little bit about resources and your experience with the faculty as well?
Yeah, sure. So one of the resources that we have that I find very helpful, and I'm glad that we have it, is called the Statewide Campus System. For short, it's SCS. And this is a program through Michigan State that all of the family programs kind of in the area, or a majority of them, get to participate in monthly lectures. And this is all organized by Michigan State, so it's a second form of didactics for us, and it's a really great resource when it comes to networking with other residents, getting more education, going over multitudes of different topics that maybe we don't get a chance to do when our own didactics. They have labs, they have procedure labs. So that is a great resource that we look forward to. And every year they're always working on making it better and improving it. So it's something that I really appreciate having. Another resource, I don't know if it's considered a resource, but to me, having our graduate medical education staff, I consider them a very important resource. And I am very, very thankful for my coordinator, who has gone above and beyond the last 2.5 years and has held this program together and supports all of the residents, keeps us on our toes, keeps us going, and is super supportive and always has your back, always ready to go to help you out, one email away, one phone call away. So she's someone that I think has really made a big difference in the quality of a program. So really appreciate her as one of our resources too. And then as far as our faculty goes, we have a lot of one-on-one time throughout the 3 years with lots of different attendings from the different hospitals, the private clinics, our FQHCs. Our program director is, and both of our assistant program directors are also clinic attendings for us, and as well as interacting with Dr. Yoder, who is our GME director. At our clinics, we get to interact with admin from Authority Health. So from any aspect of this program, we are getting so much personal time to get to know our program, get to know our attendings, and they're there for us. They support us, and they're always, like Anthony said as well, going up to bat for you, wanting to produce the best residents possible. And if you need anything, they're open to talking about it. We have a very different environment than, say, an academic program would, because we're kind of a family and more close-knit, and things are closer to the heart here. So if there's something that needs to be addressed or something that we can improve upon, it's very easy to get those things going and rolling, because you're just one phone call or text away from the person who you need to talk to about it. So it's a very unique experience. It's very tight-knit, close, and it's unique in the way that we have our faculty here. So I do really enjoy spending time with everyone and getting to know them over the 3 years. And in addition, like Anthony said, with our alumni, some of our alumni have become teachers for us. Many of them come back and still do didactics for us. They do lectures for us. They help us when we go into the work field, or like doing interviews in the future, fellowships. So everyone is still very much involved. No one really kind of graduates and then leaves Authority Health in the dust. Everyone's still there and wants to help out and participate. So that's also a very unique thing that we have.
Thanks, Shubi. It's worthy of note that more than 60% of our graduates are in physician shortage areas. More than 50% have stayed in Michigan. Approaching 20% are working in FQHCs or FQHC lookalikes. So that speaks volumes of the kind of people that do their training with us and the experiences they have. I want to thank the four of you for taking the time to share your experiences with Authority Health with our future and prospective residents, and hope you have a good evening. Thank you very much, guys.
You
Thank
too.
you.
Thank you,
Thank
Dr.
you.
Yoder.
Yep.
Bye, everybody.
Thank you.
So